past, present and emerging, and acknowledge that this always was and always will be Aboriginal land. For those of you I haven't met before, my name's Emma Cadogan, my pronouns are she, her, and I am the Director for Workforce Development at the Collaborative Centre. And I am joined by my colleague Molly, and we are going to talk to you about a new initiative called SCALE. So SCALE is an acronym for Sector Capability and Learning Expansion. And this project really recognises that there's excellent workforce development happening out there in the sector and within our mental health services, but that often that just stays within individual organisations. And we really want to change that and work with you to build on initiatives that are already being delivered and share them with more broadly across the sector. So we're really, backing what already works and helping it reach more of the workforce. And it really recognises services as leaders and having expertise in this area and sharing that with the broader platform. So we have prepared some slides for you. We're just going to give you an overview, and we know that you're going to have lots of questions. So we're mostly leaving this session for question time. And I will hand over to Molly to take us through the slides.
Okay, hi everybody. Yes, that's come up. So my name's Molly Gallia. I'm one of the Senior Workforce Development Facilitators here at the Collaborative Centre. So I've got the pleasure of coordinating this project, and I think it's really an exciting project. So I'm going to tell you a little bit about the project, what we're hoping to achieve and how it works and how you can get involved. But basically it's about something really simple, which is about finding and identifying the good workforce development already happening in services and making it more broadly available across the sector. So if you, and we'll give you this link again at the end, but that QR code, I'm pointing up there where it is for me, the QR code will take you to a website which is giving you a little bit of information, pretty much everything I'm about to go through, and it also leads you to the EOI form. So we know that across Victoria, there's a huge amount of effort going into workforce development, and we're all designing and delivering really strong training, practice development, practice guides, checklists, etc. A lot of services have individuals within them who might be doing, academic research in a particular thing or have a particular passion around, working with asylum seekers or trauma-informed care or, open dialogue or all sorts of things. And the knowledge is developed and it's really great for the people in that organisation, but it's not visible to others. And it means that often we are kind of spinning our wheels trying to duplicate training and create things that actually already exist. And it also means that often smaller and regional services don't have the capacity to develop or access that kind of training or workforce development. And we're reinventing the wheel. And for our workforce, their ability to acquire knowledge is inconsistent depending on where people work. And at the same time, we're all working towards the same reform directions, which emphasise, consistency and quality and partnership across the system. So what we want to do is find ways to share what works across the sector, reduce our duplication, make it easier for smaller and regional services to get access to training, and just make it more consistent so that consumers and carers have access to practitioners with the latest knowledge, no matter where they are. So our plan is that we're going to find out, use this EOI process that is open now to find out what services are doing and identify some services that we can fund through our SCALE initiative in order to make it available more broadly across the state. And I'll talk a bit more about what sorts of things, but this is the sort of thing we can provide. So it's a cost recovery basis. So looking at what staff time do you need, preparation and delivery of the materials, accessibility supports for people attending or for your providers, travel and accommodation if it's in person and people are travelling across the state, and any other reasonable overheads for your organisation in terms of developing it. And there's also the in-kind support that the Collaborative Centre does with all our trainers. So promotion, coordination, advertising the training across the state, using our scheduling systems and evaluating it using our standard evaluation system. So it's important that the projects that we address will look at the state priorities. So we need to embed lived experience, and we want it to have strong alignment with lived experience principles. If it's already co-designed or developed and delivered in partnership with people with lived experience, then that's a strength. If it's not, we will work with our lived experience consultants and advisory groups and in-house practitioners to support alignment and ensure that what we're offering is embedded in lived experience priorities. And also, of course, all the initiatives need to be aligned with our workforce, our future, the capability frameworks, and the state reform priorities. So the kinds of things we're looking for, it's really about things that have already been developed and delivered. So we're not about funding new programs or taking ideas from concept to reality. We'd really like to see things that have been already delivered, have evaluation if possible, or you have some idea of what the impact is on your workforces. So there can be a range of things. Training programs or workshops are the kind of obvious things. They might be practice development approaches, capability models, education that's linked to service improvement. It's really about what already works and how can more people have access to it. I think I had some ideas of different sorts of things, face-to-face workshops or training, webinars, could be different sorts of resources, checklists, practice guides, posters, e-learning packages. It might be an event or an expansion of a community of practice that's already running within your organisation that would be valuable to the broader service system. So these are the specific assessment criteria we're going to be measuring it about. Obviously, it needs to be effective and value for money. And as I said, aligned with the capability framework and the priorities for workforce development. It needs to be suitable for broad reach across the mental health and wellbeing workforce. So some of them could be discipline specific, but not just a discipline in one particular organisation, that it's attracting, all carer lived experience workers across the state, for example. Extent of lived experience leadership and review, suitability, I've doubled up there, suitability for expansion beyond your service. And we're keen to get a mix of initiatives to support workforce development. So things that are suitable or in need for regional areas, making sure we're covering different service settings. So locals, NGOs, clinical, inpatient, residential support services, etc., looking at a range of different settings and different discipline groups. And in addition, we think that it would just be a really great opportunity to acknowledge the expertise that's within your services. So some of the reasons for you to get involved are around building on your impact, helping to contribute to the mental health workforce more broadly, this idea of working in partnership as a whole sector to develop a resilient and thriving workforce. As we know, it moves around the sector. And recognising, if there are practitioners in your workplace who are delivering great professional development, what a way to recognise them to help them take it out to a broader audience. And building your organisation's profile as an expert, supporting more consistent, high quality care, and the ability to connect with others doing similar work. So we really see it as a bit of an exciting thing for organisations or practitioners to get involved in as well. So we've made it quite a simple process. It's quite a tight turnaround. As you can imagine, it's connected to the end of the financial year, so we haven't got a lot of flexibility with the time. We have quite a short EOI, so it's a brief description of your initiative. We don't need heaps of detail at this stage. And we also want an approximation of a budget. So for the ones that are selected, we'll work with you one-on-one to get a sense of the specific, learning objectives and what is actually contained within your professional development, and get more accurate on the budget. But in general, in our EOI, we really want just a good sense of who it's for, what the evidence is, how it's been developed, and whether you've done evaluations and what those outcomes were. We're going to review and select initiatives and then work together to refine and schedule delivery. So I think I put the timeline on the next page. Yes, so the EOIs are open now. They close on Tuesday, the 28th of April. And you must be able to accept one-off funding within this financial year, and we will be implementing the projects from June 2026 onwards. And that's the final slide. I encourage you to put in an EOI. If you're not sure, please get in touch and have a chat about it. That particular QR code takes you directly to the EOI form. If you go back via the other QR code that was at the start of the presentation, the web page, there's a link to the EOI form in there as well. And I'm happy to drop the links in the chat also. So that takes me to the end of my presentation. So I can't see you at the moment, so I'm just going to stop that and open it up for questions or comments or thoughts.
Thanks so much, Molly. I might dive in with some information to answer questions we had yesterday about quantum of funding and number of projects. I think people are curious about that. We're anticipating investing between $150,000 and $200,000 in this initiative, and we don't know how many projects that will fund. I think there'll be a varying level of investment or financial support required. So, but we were anticipating maybe being able to support 10 to 15, depending on what level of support and funding is required. So we'll pause there and go to you for other questions. Andrew.
Thank you, Emma. Sounds great. I was thinking as I was listening to Molly how there are lots of things that for me personally resonate with what it is you're looking to do with what we do. So just in brief, we run a recovery college we call New Perspectives College at the Alfred Care Group, which is now part of the new Bayside Health following the merger. One of the things that makes that, I suppose, a little bit different than some of the other things that people might be representing today is that we don't just bring our staff into those spaces, but we bring service users, carers, families, and even members of the community into the space. So if that was something that felt of value, and that was something that we were able to sort of get happening, would you be able to potentially help us to have some of the conversations that are really important for people who are coming into a space that for them might feel a little bit intimidating, for want of the right word, when you're creating a space where we're neutralizing power hierarchies? People don't necessarily understand what that looks and feels like. So part of our process is to actually really have a safe conversation with people, not only in the space, but before it. And I just think if that was something that was of interest across the state, how that we might manage that logistically, if you know what I mean.
Mm. It really sounds like something, Andrew, that it would be good to have a more detailed one-to-one conversation about, to see how that might work. Because it sounds like quite a unique way of getting information to our workforce. So I'd love to have a chat with you further about how we could do that.
Okay, well, if we can put in an EOI, we'll hopefully set something like that out. That'd be great.
Yeah,
Thanks.
fantastic. Yeah.
Thanks, Alex.
Thank you. Yeah, I think if in doubt, just pop one in, and then we can always follow up with you for like further information and questions. Kathy.
Hello, thank you. Hi, I'm Kathy. I'm with Eastern Health. I work in a team of clinical educators in our mental health program. So I have two questions. One's a very practical one. With the EOI, if a service has more than one initiative they want to propose, do you suggest we put in the EOI twice, one for each initiative? Yeah, okay, great. And the second one is we actually have a suite of training and workforce capability initiatives that we've been delivering over 3 years, and so this is really fitting in with what we do as a team, and we're looking at sort of what we have that we could propose through this. Looking at our workforce, our future kind of framework, some of the stuff that we do, I feel it's hard for us to map directly to it, but I'll take, for example, because I'm a pharmacy educator, so we run quite a detailed program on helping mental health clinicians be confident with medication management. So that's something that I think is applicable across all disciplines. But do you have any advice if we might struggle a little bit with linking it to that document?
Look, I will acknowledge that the capabilities set out in that framework are actually quite broad. So I'm imagining that you would be able to link it to, something. But yeah, I mean, I wouldn't. Yeah, we can have a further discussion about that if we had any questions. But I think broadly, almost anything could map into those. Either the principles or the actual capabilities, the 15 capabilities.
Mm.
Elizabeth.
Hi. I was wondering, sort of associated with this, it would also be great to have sort of a register or a clearinghouse of the type of training that people are running, because there might not be things that people. So I've got an example with the changes to psychology, code of conduct and competencies. We actually partnered with an Aboriginal scholar to develop a one-day training program for us. It's been fantastic. We've had 95% of our workforce through it. So we paid her some money to develop it, and then we've delivered it. And when we've had some surplus places, we've offered that to other health organisations. I think it's a fantastic thing. So I can't really broker her time, but I would happily help write something. So I think there are going to be some really cool initiatives that don't quite fit into this model. So maybe the next step could be some sort of way that we can register things, or
Yeah, that's a really good idea.
Yeah, I love that idea. And part of this process is actually an initial exploration with services about what they're doing and what they think might be able to be shared. And again, advice would be, even if it doesn't fit neatly, and maybe pop it in anyway, and at least it's on our radar. And perhaps the next step would be a register. We know that many services are already developing, or they've do get state funding to develop workforce programs. So in some cases, that people would be willing to share that with the state if there was a process. Just going to have a look in the chat. No questions there. Hi, Neil. How are you going?
I'm good. Well, not really, but I'm here. I'm just wondering, is it specifically for something that's already developed, or because I have something in mind, that a practice that used to happen that doesn't really happen anymore, which is, the idea around peer hubs, across services and in regions, and I, I believe there would be sort of evidence for that. But, I think there have been some barriers in the past to having that. Well, they've disappeared. It doesn't happen anymore. So, yeah, I was just wondering, I don't know if, do you need to have a fully kind of ready to roll out program, or is there an opportunity to use some of this funding to develop something that maybe needs a little bit of redevelopment before as well?
Yeah, that the idea is that it is pretty much ready to go. Might need a little bit of adaptation to be applicable beyond the service. But I'm keen to talk to you about perhaps that other idea for development. So maybe we can have a chat offline
Okay.
about that particular idea.
Thanks.
But yeah, that would be they really need to be quite developed and tested, I think. Thanks. Hi, Lisa.
Hello, sorry, I was a bit late because I couldn't get into the meeting, so I'm sorry if I've missed some of the slides. I work at the Royal Melbourne as part of one of the principal psychology educators, but also in the learning and development team, and I run a program called the Activating Recovery Program, which is something that we've been delivering for a long time. It's a big program, so I guess in thinking about if that was something that would be of interest to the Collab Centre, I guess it's maybe taking a bit on what Elizabeth was saying, thinking about how it fits in the broader scope, but also what elements of that might be of interest to the centre, because I imagine the whole program would be too big. So I guess it might be thinking, maybe this is another offline conversation, but putting the expression of interest out there and thinking about what we could deliver. We used to deliver things through the centre, so I imagine it might just be a parallel, something that might be similar to that and then expanding on that. But I guess I'm not quite sure how to funnel it, if that makes sense.
Yeah, I think if it's like a broader program, maybe include as much information about that program, and then I guess there'd be a way in which we could work out options for, modules, different modules or components of the program, depending on priorities. And it's probably about it's probably we should say that we've got our workforce development needs analysis interim report underway at the moment, and so we would be. It's probably about what's valuable for the sector, and we're starting to get information about what the workforce are wanting. So we will be having a look at that as well at the same time. So that might help us drill down into specifics.
I assume if you have questions afterwards, it's not a yay or nay, it's purely based on the EOI, that you'll follow that up and have further conversations. Okay, that's, as long as I know that, then I'm fine.
Yeah, we just wanted to create an easy process for services to tell us, what they've got and what they'd like to put forward, and with not too much information in the first instance, so just to get an idea, and then we can follow up. Any other questions or comments? Well, it sounds like you've all got some really exciting initiatives to put forward, so I'm looking forward to seeing what comes through. Luke.
Hi there. It sounds fantastic. I've got a bad habit of asking half-formed thoughts and questions and mushing them together, as some of my colleagues in the room who know me well from other meetings. we I can see some programs and some initiatives that would easily be shareable. And it's a good example. A colleague at another service and I wrote an LMS package on the psychology competencies and code of conduct last year, and we just shared that across the state. So like I think about more than 300 psychologists have completed it now. So it's great. We were just able to share that, and we did that through our existing networks. When I think about education programs that we have developed for our psychology staff, for example, what comes to mind is the administration that goes along with running a program like that. It's not just delivering sessions. It's like the pedagogy means you need to be marking things, you need to be giving feedback. It's not just delivering sessions. So what I'm not so clear about is whether the Collab Centre is offering to help with that element of education programs, or is it just some money to scale up, but then the administrative, I'm going to say burden for lack of a better word, would sit with the service who's developed the training. Do you have any comments about what hopefully that's clear, but do you have any thoughts or comments about that?
Yeah, that's a good question. And I think it might be, it could be different for each initiative, because some services may actually want to, kind of have that sort of level of autonomy and control and do that administration, or there might be things that we could do to alleviate the administrative burden, and if we've got capacity like that kind of support, we can consider as well.
It's a bit of a pilot, Luke, so we're figuring it out as it goes along. It'll depend very much on what comes in and what's needed. So happy to have a look at it and have a think about how it might fit with what we're doing.
Wonderful. Well, thank you again so much for your interest and for all the great work that you're doing out there in the sector. And we are really hopeful that we're going to get a lot of interest and learn a little bit more about what you're doing. So yeah, if you've got any questions outside of this, please feel free to follow up with us. And yes, we'll email the slides. We'll share it with everyone that registers. And we're also going to be sharing the recording for others.
Great. Lovely to meet you all.
Thanks so much.